What is schizophrenia? Schizophrenia is a psychiatric disorder characterized by continuous or relapsing episodes of psychosis. Major symptoms include hallucinations, typically hearing voices, delusions, and disorganized thinking. Other symptoms include social withdrawal, decreased emotional expression, and apathy. Symptoms typically come on gradually, begin in young adulthood, and in many cases never resolve. There is no objective diagnostic test. Diagnosis is based on observed behavior, a history that includes the person's reported experiences, and reports of others familiar with the person. To be diagnosed with schizophrenia, symptoms and functional impairment need to be present for 6 months DSM-5 or 1 month ICD-11. Many people with schizophrenia have other mental disorders that often includes an anxiety disorder such as panic disorder, an obsessive-compulsive disorder, or a substance use disorder. About 0.3% to 0.7% of people are affected by schizophrenia during their lifetime. In 2017, there were an estimated 1.1 million new cases, and in 2019 a total of 20 million cases globally. Males are more often affected and on average have an earlier onset. The causes of schizophrenia include genetic and environmental factors. Genetic factors include a variety of common and rare genetic variants. Possible environmental factors include being raised in a city, cannabis use during adolescence, infections, the ages of a person's mother or father, and poor nutrition during pregnancy. About half of those diagnosed with schizophrenia will have a significant improvement over the long term with no further relapses, and a small proportion of these will recover completely. The other half will have a lifelong impairment, and severe cases may be repeatedly admitted to hospital. Social problems such as long-term unemployment, poverty, homelessness, exploitation, and victimization are common consequences of schizophrenia. Compared to the general population, people with schizophrenia have a higher suicide rate, about 5% overall, and more physical health problems, leading to an average decreased life expectancy of 20 years. In 2015, an estimated 17,000 deaths were caused by schizophrenia. The mainstay of treatment is antipsychotic medication, along with counseling, job training, and social rehabilitation. Up to a third of people do not respond to initial antipsychotics, in which case the antipsychotic clozapine may be used. In situations where there is a risk of harm to self or others, a short involuntary hospitalization may be necessary. Long-term hospitalization may be needed for a small number of people with severe schizophrenia. In countries where supportive services are limited or unavailable, long-term hospital stays are more typical. Schizophrenia signs and symptoms. Schizophrenia is a mental disorder characterized by significant alterations in perception, thoughts, mood, and behavior. Symptoms are described in terms of positive, negative, and cognitive symptoms. The positive symptoms of schizophrenia are the same for any psychosis and are sometimes referred to as psychotic symptoms. These may be present in any of the different psychoses, and are often transient, making early diagnosis of schizophrenia problematic. Psychosis noted for the first time in a person who is later diagnosed with schizophrenia is referred to as a first episode psychosis, FEP. Schizophrenia positive symptoms. Positive symptoms are those symptoms that are not normally experienced, but are present in people during a psychotic episode in schizophrenia. They include delusions, hallucinations, and disorganized thoughts and speech, typically regarded as manifestations of psychosis. Hallucinations most commonly involve the sense of hearing as hearing voices, but can sometimes involve any of the other senses of taste, sight, smell, and touch. They are also typically related to the content of the delusional theme. Delusions are bizarre or persecutory in nature. Distortions of self-experience, such as feeling as if one's thoughts or feelings are not really one's own, to believing that thoughts are being inserted into one's mind, sometimes termed passivity phenomena, are also common. Thought disorders can include thought blocking, and disorganized speech. Speech that is not understandable is known as word salad. Positive symptoms generally respond well to medication, and become reduced over the course of the illness, perhaps related to the age-related decline in dopamine activity. Schizophrenia negative symptoms. Negative symptoms are deficits of normal emotional responses, or of other thought processes. The 5 recognized domains of negative symptoms are: blunted affect, showing flat expressions or little emotion; alogia, a poverty of speech; anhedonia, an inability to feel pleasure; asociality, the lack of desire to form relationships; and avolition, a lack of motivation and apathy. Avolition and anhedonia are seen as motivational deficits resulting from impaired reward processing. Reward is the main driver of motivation, and this is mostly mediated by dopamine. It has been suggested that negative symptoms are multidimensional, and they have been categorized into two subdomains of apathy or lack of motivation, and diminished expression. Apathy includes avolition, anhedonia, and social withdrawal. Diminished expression includes blunt affect and alogia. Sometimes diminished expression is treated as both verbal and non-verbal. Apathy accounts for around 50% of the most often found negative symptoms and affects functional outcome and subsequent quality of life. Apathy is related to disrupted cognitive processing affecting memory and planning, including goal-directed behavior. The two subdomains has suggested a need for separate treatment approaches. A lack of distress, relating to a reduced experience of depression and anxiety, is another noted negative symptom. A distinction is often made between those negative symptoms that are inherent to schizophrenia, termed primary, and those that result from positive symptoms, from the side effects of antipsychotics, substance abuse, and social deprivation, termed secondary negative symptoms. Negative symptoms are less responsive to medication and the most difficult to treat. However, if properly assessed, secondary negative symptoms are amenable to treatment. Scales for specifically assessing the presence of negative symptoms, and for measuring their severity, and their changes have been introduced since the earlier scales, such as the PANSS that deals with all types of symptoms. These scales are the Clinical Assessment Interview for Negative Symptoms (CANES) and the Brief Negative Symptom Scale (BNSS), also known as second-generation scales. In 2020, 10 years after its introduction, a cross-cultural study of the use of BNSS found valid and reliable psychometric evidence for the five-domain structure cross-culturally. The BNSS is designed to assess both the presence and severity and change of negative symptoms of the five recognized domains, and the additional item of reduced normal distress. BNSS can register changes in negative symptoms in relation to psychosocial and pharmacological intervention trials. BNSS has also been used to study a proposed non-D2 treatment called September 363856. Findings supported the favoring of five domains over the two-dimensional proposition. Schizophrenia cognitive symptoms. Cognitive deficits are the earliest and most constantly found symptoms in schizophrenia. They are often evident long before the onset of illness in the prodromal stage, and may be present in early adolescence or childhood. They are a core feature but not considered to be core symptoms, as are positive and negative symptoms. However, their presence and degree of dysfunction is taken as a better indicator of functionality than the presentation of core symptoms. Cognitive deficits become worse at first episode psychosis but then return to baseline, and remain fairly stable over the course of the illness. The deficits in cognition are seen to drive the negative psychosocial outcome in schizophrenia, and are claimed to equate to a possible reduction in IQ from the norm of 100 to 70 to 85. Cognitive deficits may be of neurocognition, non-social, or of social cognition. Neurocognition is the ability to receive and remember information, and includes verbal fluency, memory, reasoning, problem-solving, speed of processing, and auditory and visual perception. Verbal memory and attention are seen to be the most affected. Verbal memory impairment is associated with a decreased level of semantic processing, relating meaning to words. Another memory impairment is that of episodic memory. An impairment in visual perception that is consistently found in schizophrenia is that of visual backward masking. Visual processing impairments include an inability to perceive complex visual illusions. Social cognition is concerned with the mental operations needed to interpret and understand the self and others in the social world. This is also an associated impairment, and facial emotion perception is often found to be difficult. Facial perception is critical for ordinary social interaction. Cognitive impairments do not usually respond to antipsychotics, and there are a number of interventions that are used to try to improve them. Cognitive remediation therapy has been found to be of particular help. Schizophrenia onset. Onset typically occurs between the late teens and early 30s, with the peak incidence occurring in males in the early to mid-20s, and in females in the late 20s. Onset before the age of 17 is known as early onset, and before the age of 13, as can sometimes occur, is known as childhood schizophrenia or very early onset. A later stage of onset can occur between the ages of 40 and 60, known as late onset schizophrenia. A later onset over the age of 60, which may be difficult to differentiate as schizophrenia, is known as very late onset schizophrenia like psychosis. Late onset has shown that a higher rate of females are affected, they have less severe symptoms, and need lower doses of antipsychotics. The earlier favoring of onset in males is later seen to be balanced by a postmenopausal increase in the development in females. Estrogen produced pre-menopause has a dampening effect on dopamine receptors, but its protection can be overridden by a genetic overload. There has been a dramatic increase in the numbers of older adults with schizophrenia. An estimated 70% of those with schizophrenia have cognitive deficits, and these are most pronounced in early onset and late onset illness. Onset may happen suddenly, or may occur after the slow and gradual development of a number of signs and symptoms in a period known as the prodromal stage. Up to 75% of those with schizophrenia go through a prodromal stage. The negative and cognitive symptoms in the prodrome can precede FEP by many months, and up to 5 years. The period from FEP and treatment is known as the duration of untreated psychosis (DUP), which is seen to be a factor in functional outcome. The prodromal stage is the high-risk stage for the development of psychosis. Since the progression to first episode psychosis is not inevitable, an alternative term is often preferred of at-risk mental state. Cognitive dysfunction at an early age impacts on a young person's usual cognitive development. Recognition and early intervention at the prodromal stage would minimize the associated disruption to educational and social development, and has been the focus of many studies. It is suggested that the use of anti-inflammatory compounds such as D-serine may prevent the transition to schizophrenia. Cognitive symptoms are not secondary to positive symptoms, or to the side effects of antipsychotics. Cognitive impairments in the prodromal stage become worse after first episode psychosis, after which they return to baseline and then remain fairly stable, making early intervention to prevent such transition of prime importance. Early treatment with cognitive behavioral therapies are the gold standard. Neurological soft signs of clumsiness and loss of fine motor movement are often found in schizophrenia, and these resolve with effective treatment of FEP. Thanks for watching our video. Make sure you subscribe to receive more video related to schizophrenia treatment, and many other everyday health and wellness. Don't forget to leave a comment, hit the like button, and share our video. Thank you so much for watching. Be safe, and stay healthy.